My name is Lisa Flagg with the Fulton Dekalb Hospital Authority, and you are watching Branching Out.
I'm Dottie Peoples, and you're watching Branching Out.
Hi everyone, I'm Gloria Gobin from Bass Wives LA, and you just caught me on Branching Out.
Hi, we're the Braxtons, and you're watching Branching Out.
You are watching Branching Out.
Wow, you look beautiful.
Thank you.
All right, hey, it's Blair Underwood watching Branching Out.
But I'm Bobby Jones, and I'm branching out for real.
And it's a beautiful thing.
Branch now.
And I'm just excited to be back to celebrate the 20th anniversary.
Hello, my name is Lisa Flagg, and I'm the CEO of the Fulton Dekalb Hospital Authority. And we are here at the Hyatt Regency. We are hosting our 5th annual Health Summit. And if you're not here, you are welcome to follow us on hashtag the FDHA Health Summit. And we have lots of people here learning information about how to prevent diseases, how to improve health in our communities. Well, this is our 5th time holding a health summit for our communities. If you're not aware of the Fulton Dekalb Hospital Authority, we actually own Grady Health System, and we understand the importance of improving and preventing diseases. And so that is why we are committed to having this summit each year. We understand that information is power. And so it is our job, as we see it, to make sure we're providing information to empower our communities. And so we also will have an HIV summit next year. So remember the date of 10/10/2017.
Is one of the most grass-top organizations that know how to relate to the grassroots in the country. And I attribute that to the board and to our great chairman, Tommy Deutsch. Let's give a board to Tommy Deutsch. If you can ever get the grassroots and the grass tops to come together, this is the organization that can do it, because we're here to serve and make things happen. I said it last night and I say it again. Fulton Dekalb Hospital Authority is where our potential is bigger than our problems. You can come here and make things happen. And I'm glad that I'm a part as the county commissioner in DeKalb County, Georgia, Larry Johnson.
I discovered I had adenocarcinoma 27 years ago, 9 years ago, because at age 45 I started having my prostate exams, I used to say to the men then, you could be macho and dead. Started through the 100 Block Clinic of America having folks get prostate exams. 9 years ago, on my routine exam, they discovered my PSA was high. I had a biopsy, discovered I had prostate cancer. Earliest stage, one of the earliest, but I had the seed implant. But again, I would be dead today had I not gone in every year. Still to this day, I get my exams. I'm an entrepreneur. But also, if I have the slightest pain, I go to my doctor. I pay for insurance and I use it. So my advice to everybody is, why have insurance? Why have access? Because even great, if you don't have insurance, we'll still take it. And so why have access to healthcare and not use it? And my other advice is that healthcare should not only be available to people with means, it should be available to every citizen.
I made a lot of bad decisions in my life as a young man, and of course I went to prison for 15 years for 13 major felonies. Just to have no direction in life, no guidance. And one of the things I learned as a young man, even out here mentoring young people, is that so many young people live reckless lives. Mainly because a lot of them don't know it. Same way as me, I didn't know it. No one really grabbed my hand and said, this is what you do, this is what you don't do. This is what you need to know. I just live according to what I see every day. Since I've been out of prison, I've been out going on 9 years now. As I mentor young people, my encouragement is try to encourage them to make better choices in life, whether it's from for not committing crimes, or to get back to school, all the way down to having to take the steps. Because these are things that wasn't taught to me as a young man. And so I had to learn through hard trials and tribulations. Like you said, going to prison, man, just really disrupted my life. Even today.
today, even being out of prison, almost 9 years, still has an effect on me because I hate the life I live. Because, trying to, I don't want to say catch up, because I can't catch up, I can't make up 15 years, but I went in prison when I was 18, and when I got out, I was still 18. Because the only thing I learned how to do in prison was survive. All I know how to do is eat soup and pies. Only thing I can say, I got saved, of course, I got involved and got my faith in place, but I didn't know how to survive as a man. I didn't know how to date. I didn't know anything about politics. I didn't know anything. I just knew how to get out. I knew I wanted to be proud of it, I didn't want to be in prison. But still, getting out of prison, that became the challenge, and it's still a challenge for me because I'm still learning what I probably should have learned when I'm in my 20s.
I have a diagnosis of living with AIDS. So for me every day, if I want to live and be productive and see my family and have a social life, I have to take medicine every day of my life. So making sure I take my medicine is important. And we all think, okay, just popping a pill, that should be easy. But we also have to keep in mind that I also have to make sure that my mental health is okay. That I'm not sad or depressed. Because when you are depressed, you don't want to take your medicine because you don't see the point of getting out of bed. And so I'm a strong advocate for also mental health for those living with HIV/AIDS and just individuals in general because life is so hard and there's so many factors. So in order for me to take my medicine, make sure that my body is healthy so that I can date and have children and make sure that I'm virally suppressed so that if I do choose to have sex, my partner has less than a 4% chance of actually contracting HIV. That if I do want to have a child, that I'm virally suppressed so I can carry my baby without passing HIV onto my baby, I have to make sure that I'm taking these pills every day, going to see a doctor. And now I'm also learning, because there was a time at a point where I couldn't retain weight. So my mom had a really fatty diet when I was growing up. And now it's like the medicine is working better. I don't have stomach problems. And all of a sudden I blew up.
And because it's one of the things I talk to my patients, I think they must think I'm crazy that no matter what their problem, I ask them if they're exercising. But you'd be surprised how important those lifestyle issues are. And I'm trying to encourage people to think about how much it comes back to that being physically active, always being challenged by your diet, I will always struggle with that, but also understanding that you start to feel better, the rewards pay off throughout your life, you're less stressed, you're more engaged, your physical problem, you have a lower risk of cancer, like we talked about this morning, a lower risk of cardiovascular disease, a lower risk of diabetes. A study that came out this year said that if women who exercise are less likely to get breast cancer, they're less likely to have a recurrence if they exercise.
Your health is your wealth. We spend a lot of time talking about health disparities. One data point, and we're all good, I'm sure, on the side for data. Health disparities, racial and ethnic health disparities in this country is a $500 billion industry. So if you think about the cost in direct and indirect care and medical care, productivity costs, all these costs add up due to health disparities. And when I think about what we could do with $500 billion in this country, we could solve another really big problem that we have, which is education. So we, in my field, say the single greatest determinant for positive health is your socioeconomic status. The wealthier you are, the healthier you are. And the single greatest determinant for socioeconomic status is education. So we're out trying to educate people on how to take care of their health. And lifestyle is critically important. We have programs that help women do little things every day to be healthy. And we realize the connection between your emotional health, your physical health, and your economic health.
So there is a popular saying that says there is no health without mental health, right? So if we don't start at the top, we're going to have a very difficult time taking care of ourselves. And I'm glad you mentioned meditation because it's an exercise. Those are the two, they're free, doesn't cost anything, just time. And what it does to the body and what it does to the mind is amazing things. You can start every day
You make decisions from the time you wake up. You can begin your day with coffee, cigarettes, or you can begin your day with prayer, meditation.
Stress, mental health, and I think if we could all just kind of, we've got community, we've got experts, maybe give, because you know that whole stereotype of the angry black woman, I think that's something that we all deal with every day. What are some tips that we can take, or some community resources for people who do feel stressed? In my own clinic, I don't see any patients usually that at least 2 or 3 times a day somebody's crying in my office, and I'm sure you have a similar experience. So what are some just quick moments or quick community resources that people can learn how to meditate or de-stress or kind of handle some of the issues that they're dealing with? Because the science does show that it increases your risk of cancer, hypertension, diabetes, heart attack, stroke, the list goes on and on. But what has to change is how we respond to the stress and how you let it pass through you so that it doesn't create chronic